welcome to our special show on diabetes. I'm Gargi Rawat. The number of individuals affected by prediabetes is increasing rapidly in all areas of the world. The prevalence of prediabetes in India is often underestimated, and the majority of people with prediabetes don't even experience any symptoms. So there's a large proportion, a larger part of our population of undiagnosed patients. Having prediabetes means you're at increased risk for developing serious health problems such as type 2 diabetes, stroke and heart disease. Prediabetes is also very treatable, and if you have it, well, there's a good chance that you can prevent or delay type 2 diabetes by making changes in your diet and increasing your level of physical activity. A better understanding of prediabetes could help with earlier identification, thereby allowing earlier intervention and potentially lowering the number of individuals who go on to develop diabetes. There are many myths and queries about prediabetes. Today we have with us eminent endocrinologists who can help us understand them and manage pre-diabetes better. Thank you so much, doctors, for joining us. And we're joined by Dr. V.V. Rama Kumar, Fellowship in Diabetes, India Mary Jane Maes Scholar and recipient of the National Award in Diabetes India. We're also joined by Dr. Ravindra G. Shukla, Additional Professor, AIIMS, Jodhpur. Thank you so much, doctors, for joining us on the program. And Dr. Shukla, I'd like to start with you. Pre-diabetes is a health condition that can progress to type 2 diabetes. So how close is pre-diabetes to type 2 diabetes? And does the transition from pre-diabetes to type 2 diabetes happen quickly, or does it take a long time?
Okay, as the name suggests, it's pre-diabetes, which means that diabetes eventually is going to occur. Now, the thing is, how much percentage of the patients would eventually become diabetic? So, 10 to 15% of those having diabetes will become diabetic in 1 year. So, that rate, it is like every year 10 to 15% would convert to diabetes. Now, the thing is, even in this thing, how much is risk at individual level? So, if the fasting blood glucose it's more than 110, it's pretty likely that in 1 or 2 years one would be a diabetic. One more thing is, apart from the fasting blood glucose, there is something which we call the probability in next 5 years. So if for 5 years you are a pre-diabetic, there's a less chance that you will eventually become a diabetic. So it's about next to 2 or 3 years. These are very crucial for every pre-diabetic patient.
Right. Now, Dr. Rama Kumar, we keep hearing that diabetes is a ticking time bomb in India, and you know how Indians are more prone to pre-diabetes. Why is this, and is it possible to prevent pre-diabetes?
Yeah. Namaskaram. Andariki namaskaram. Today we are talking about a very relevant point. Why Indians are more prone for diabetes? There are multiple factors for this. By genetically, we are called as thin fat Indians. We may look thin, but we have a lot of visceral fat. Visceral fat can cause insulin resistance and make you a diabetic. So pre-diabetes is a chance where we can interfere and prevent the progression to diabetes. So Indians, by genetics and by urbanization and changing the food habits and stress and other factors, is causing more Indians to become diabetics. And they say that when you compare with the Western countries, Indians are developing diabetes a decade earlier than that. So we should remember that all of us are prone to develop diabetes, and it is possible to prevent diabetes if we can detect pre-diabetes and do some interventions or like a change in the lifestyle and other things. Then we can prevent the diabetes development in Indians.
All right, Dr. Rama Kumar. All right, going across to Dr. Shukla now. As pre-diabetes is just a starting phase of diabetes, can it still cause heart problems? If you could, explain that, the impact it could have on our heart health.
Okay, that's a very, very good question, and also relevant because a lot of patients who are having pre-diabetes, they have this query. So the answer is people with prediabetes, they're very likely to have coronary artery disease, and this risk is more if you have somebody in your family who's already having a coronary artery disease or has undergone a bypass surgery. The chances are almost triple, 3 times than the general population. So these patients who are having prediabetes, they could and they should get done their cholesterol levels. We are likely to find bad cholesterol levels to be quite high in these individuals, and that should be treated to prevent heart disease or what we call coronary artery disease from occurring. So this is what we call, dyslipidemia, and apart from this, we should take all the measures like monitoring of the blood pressure, which can be done even at the home. And now it's possible with various. So these things should be, focused on in these patients.
All right, Dr. Rama Kumar, is HbA1c test enough to detect pre-diabetes? Do we need to do additional tests like the OGTT to confirm a diagnosis of pre-diabetes?
I can't hear you. Can you?
All right, I was asking whether the HbA1c test was enough to detect pre-diabetes. Do we need to do additional tests?
I didn't answer. Hear your question. What?
All right, I'll try to fix that with you. I'll just ask the same question to Dr. Shukla. Dr. Shukla, if you could just tell us about the HbA1c test, is that enough to detect pre-diabetes?
And HbA1c, I would say, is very useful to detect, although we will need both the fasting and the postprandial blood glucose for detection of pre-diabetes. What HbA1c is actually, it gives a kind of an average blood glucose level. So that's what the test is. And if we have a range of 5.8 to 6.4, so that's what we would label as a pre-diabetes. But yes, we will also need fasting blood glucose and postprandial blood glucose for confirming that. Yes.
Right, right, Dr. Shukla, anything you'd like to add to that?
HbA1c, we call A1c.
Your question was HbA1c is enough for diagnosing pre-diabetes. Definitely HbA1c is easy to do because it can be done at any time. But my professor, all our professors used to say that whenever you diagnose diabetes or anything, it is better to do 2 tests. So HbA1c and 2 hours post glucose or fasting, they should be done, because we are going to give the name to the patient that you are a pre-diabetic. So it is better to have 2 tests than 1 test to confirm the pre-diabetes.
All right, so better to take 2 tests to confirm that indeed you have pre-diabetes. You can take the various steps needed, to reverse it or to improve your health so you don't develop full-blown diabetes. We'll slip into a short break right now and return with more questions for the doctors. Stay with us. Welcome back to our special show where we're talking about diabetes and, more importantly, pre-diabetes, a condition that many people have but don't realize they do. And it's very important to be aware of this, as there are several steps you can take to improve your health and not develop full-blown diabetes. Well, let's go across to the doctors who are answering all our questions. And Dr. Shukla, our next question to you: what steps can a person take to work towards reversing pre-diabetes, and which other lifestyle changes along with the medical treatment are advised to reverse pre-diabetes?
Okay, I think talking about the steps, I think we should all start taking steps. Actually, the exercise is one of the best measures which we can take to reverse pre-diabetes. And that said, it's also important to focus on the dietary and the calories also. When we talk about exercise, it has to be calibrated and should be properly given to prescribed to the patients. Even 8 to 10 kg of weight loss is what we desire when somebody is having pre-diabetes, and if somebody has can have that, achieve that weight loss, we can get assured that almost the diabetes we can keep at bay. Also, it's also very important that because of our lifestyle, most of the time we are sitting and doing jobs. So it's very important that we should take a break after every 10 to 15 minutes and start walking. That's very useful. Sitting for long periods is very is a very important risk factor for conversion to diabetes. And even a weight loss of, for example, 3 kg can reduce the risk of diabetes by maybe 30 to 40%. So even small weight loss, that's very useful.
Right. Dr. Rama Kumar, should a person reduce carbohydrate consumption? We were just talking about, increasing physical activity, etc. But what about diets? So should people reduce their carbohydrate consumption if he or she is pre-diabetic?
Yeah, definitely diet plays a role. They have to take a balanced role by contracting their doctor, and definitely what we advise for both diabetics or pre-diabetics, a carbohydrate of 45%. So it is better to reduce the calories. So if you reduce the calories, then there will be a weight loss. Weight loss and exercise, they have shown to prevent diabetes conversion from pre-diabetes. So we always advise patients to take a balanced, well-balanced diet and a lot of fiber, because fiber has shown to increase the insulin. It improves the insulin resistance, and it is useful to prevent diabetes. Lot of fiber and less carbohydrate, and we have to compensate the protein also. All these factors, a well-balanced diet will definitely cause the conversion of pre-diabetes to diabetes. So definitely diet plays an important role.
All right, we're also joined by Dr. Lily Rodrigues, diabetologist, Stride Hospitals, Hyderabad. Thank you so much, doctor, for also joining us. And if you could talk about what are the female-specific disorders which can cause pre-diabetes in women?
Yeah, thank you very much for asking me this question, because it's very close to my heart. Females, right from their girlhood until they become elderly women, they are very much prone, just as men, they are also prone for diabetes. And the first and foremost, the girls with PCOS, obesity and sedentary lifestyle, combination of these two pushes them into becoming a pre-diabetic. Then the other stage of a woman's life is a transition to menopause, transition from pre-menopause stage to menopause stage. That is when a woman goes goes through a lot of stress and also metabolic changes within her, and she is again becoming a very high risk person for becoming a pre-diabetic. And then post-menopausal phase as well, a woman because of the hormonal changes within her, she is also more prone for becoming a diabetic. So these are all the phases and preconditions which a woman can suffer from pre-diabetes.
Right. Now, Dr. Shukla, what is the role of self-monitoring of blood glucose in the management of pre-diabetes? How important is this?
Okay, yeah. So self-monitoring of blood glucose, which we call SMBG, the doctors call it SMBG, is actually just checking the blood glucose with the help of glucometer and recording it in a diary or in a mobile digitally. So that's what SMBG is. It's very important for management of diabetes, but we need to keep it in mind that it's not yet recommended for people with diabetes at present. Maybe with more and more digital technologies progressing, we might have some change in these guidelines, but at present SMBG is not recommended, which means checking the blood glucose levels on their own at home is not recommended for people with pre-diabetes.
Right. Dr. Rodrigues, now earlier we were talking about on the program about exercise and how it's important to make these lifestyle changes when managing your pre-diabetes. But if you could, explain that further, when is the best time to exercise for pre-diabetes and how much exercise should they do?
Yes. As far as all the research results are concerned, that is everywhere, not only in India, but globally, what is said is 30 minutes a day or 150 hours in a week. Exercise is required to prevent diabetes and also pre-diabetes as well. And then when to do the exercise is a person's choice. Actually, it can be done in the morning. That's the best time, we say, because of the outside environment is very conducive for a morning exercise, and we are fresh enough to do the exercise. But if one cannot do the exercise in the morning, any time of the day is good for any exercise. So it need not be just walking brisk or jogging and walking, but it can be any sort of exercise a person enjoys. For instance, if a young girl needs to reduce weight, walking alone may not be enough. That person should do, go for an aerobic exercise or cycling outside or anything that a person enjoys doing the exercise, because that is when most of the endorphins get released and they work as antioxidants and also prevent diabetes, because it increases the insulin within the persons to act better, to make the cells responsive to the innate insulins that are there, and that is when the exercise is most important.
Right, Dr. Rama Kumar, let's talk about supplements now. There are several supplements and products which are available in the market which claim to reverse pre-diabetes, and it's very difficult to understand for a layman the kind of claims that are being made, and one could get swayed. Should people trust such supplements?
Yeah, one thing I want you to tell about supplements: be cautious about supplements and don't believe them blindly. You ask your doctor whether these supplements are useful, but I mostly believe the supplement called laughter. So because we all are stressed and we are having a lot of stress, laughter definitely helps you to reduce blood sugar. In Japan, there was a study done and it has shown that if you laugh after eating, then there is a reduction in the postprandial blood sugar, or there is a increase in the postprandial sugar. And I also got trained in laughter yoga. Laughter yoga also definitely helps you. So instead of supplements, these theories which show that keep laughing, laugh with your family, friends, and don't be serious in life, because as Madam said, endorphins are useful in reducing the blood sugar and the stress hormones. So keep laughing, and laughter will definitely help you. Thank you.
All right, so you're saying laughter is the best supplement, but on the other hand, you're saying that stress is also a huge problem. If you could tell us a bit more about that. Does stress then further exacerbate the issues of pre-diabetes?
Yeah, definitely stress plays an important role in production of diabetes. So you take the life easily, like with exercises and cycling or walking, and then take some yogas and then doing pranayama, laughter yoga. All these things will help you to reduce the stress, and if you can reduce the stress, definitely you will have less chances of becoming a diabetic, and laughter yoga and laughter therapy has shown to reduce. I'm not suggesting just laughter yoga or laughter therapy. Along with the other exercises and diet, you take this also instead of supplements. Definitely it will help, and try to reduce your stress.
All right, reducing stress it seems to be the key in managing health, especially these days when there's been such an emphasis on health and how to have better health. Dr. Rodrigues, can someone with excess weight and pre-diabetes reduce the risk of developing type 2 diabetes?
Yes, that's a wonderful question, because that is the thing that we are concerned about, because obesity is increasing in leaps and bounds in India as well. So even if one tries to reduce weight by 5% of the entire weight, supposing a person has 100 kgs of weight and she reduces 5 kgs of her weight, her chance of becoming a pre-diabetic comes down by almost 30%. So this is how it's important. So obesity must be considered, obesity must be reduced, and then ways and means has to be understood by individual. I mean, it may not be the same for every individual, so each one has to understand what makes her or him obese, and it has to be tackled at the very early stage, even before becoming a pre-diabetic, especially if a person has family history of diabetes, and if a woman had a gestational diabetes and she remains obese, because particularly if she has more than one pregnancies, I mean, so they, keep on adding weight to the first pregnancy, and then it remains, then it becomes second pregnancy, and then again increases the weight. So it is very, very important to understand this and reduce the weight as much as possible, but definitely 5 to 10% has to be reduced, come what may.
All right, so that's important to keep in mind. And then finally, a question to Dr. Shukla. Dr. Shukla, at what age does one start becoming, worried about something like pre-diabetes? When should people start going in for, checks and monitoring whether or not they are developing pre-diabetes?
I think if you have a family history, which means somebody in your family is having, diabetes, in that case, you need to, I think, get an yearly checkup after 25 years of age. Other getting obese, or you are having weight which is higher, you should get a routine test every yearly, whatever your age is. Otherwise, if nobody in your family is diabetic, you are also fit and fine, still you need to keep on doing tests after age of 30 years, every yearly, the routine test, which means the blood glucose tests and those tests to pick up once you get pre-diabetes.
All right. Well, thank you so much, doctors, for joining us. I think the main points are to reduce stress in your life, have regular, exercise in your life, laugh more for sure, and of course, control your diet as well. Thank you so much for joining us, and thank you all for watching at home. Goodbye.